Welcome to Dil Diya Galla. I'm your host and host Aditya and I'm in conversation with Dr. Vanita Arora. She's a director of cardiac electrophysiology and intervention cardiology at Max Super Speciality Hospital, Saket, Delhi. During the course of the series, I'm going to be in conversation with her, discover a lot about her and her field and understand ways to improve your cardiac health. So follow us and stay tuned for more videos. Hello doctor, hi.
Hi Adi, how are you?
I'm doing very well, how are you?
Good, doing well too.
Wonderful. So I think to begin with, we want to know what's your day like? A day of a doctor. I think I'm very intrigued. How does it go?
I'm a normal human being. My day starts like a normal smile, thanking God, and maybe going for a walk for about 30-40 minutes, and then coming back to my big cup of tea and getting ready for the hospital. In between, a lot of phone calls to attend to, some from the patients, some from the colleagues for the admitted patients, and that's how I go.
Lovely. But a tea lover like me, I think I'm a person who has probably 2 or 3 cups of tea a day. How healthy is it? Like a lot of people have this suspicion about tea not being leading to acidity beyond a certain amount.
Yeah, of course. You see, tea has its positive and negative points, right? Here I would like to add, Adi, green tea has become a fad nowadays, right? I don't think so. The conventional tea that we make in our houses is as bad if taken in limited quantities, which means 1 or 2 cups a day. But green tea per se, it's become a fad. Everybody wants to take it for a weight loss. There are certain advertisements going around. But trust me when I tell you, I have had patients coming to me with loss of consciousness, dehydration, feeling very weak, having palpitations, their heartbeat going fast. And this all starts with the intake of green tea. As soon as they started taking green tea, they have started having these symptoms. So I would give a caution about moderation of green tea. Much more than the other tea because it's not good, it's very dehydrating.
Okay.
So it's not good for everybody, and please do not take it like every hour.
It's not a medicine at the end of the day.
It is not. It is not. Some flavor teas like with the fragrance of some flowers and all can be good. You can take a 1 cup in a day or 1 cup in 2 days, but don't make green tea a fad.
So this is my only cup for the day.
Yes, me and mine too.
Wonderful. I'd like to know a little bit about you out there. What are your hobbies? What is your interest? How's your day outside a hospital like?
I am a two-faced person. One phase is in the hospitals, that's for my patients, because that has to have a serious exterior as well as interior. In India, to be taken seriously, you actually have to carry that phase. I would not say I have a split personality, but that's part of my professional personality. But personal personality, of course, I go, as a normal girl would go, normal woman would go. I am into a lot of sports. Used to be in the college time. I was basketball, hockey, table tennis, badminton.
Lovely.
Yeah.
Lovely.
And they used to be my passion. Someday, there was a time when I used to think I'll be a national basketball or hockey player. But anyway, God had different things for the time.
But I think, thinking about what you're saying out here, I've realized a lot of kids in today's time are devoid of those outdoor physical sports. How essential is a sport, or not necessarily a sport, but some kind of a physical activity for us and our cardiac health?
I think that's a very, very interesting and a good question. I would want to concentrate on the answer in 2 parts.
Right.
One, how good it is to be physically fit. As Indians, you have to understand the males and Indians are genetically prone to have blockages in the arteries of the heart. We can't go away from our genes. And if you have a family history, your parents, uncles, aunts, siblings having the blockages in the arteries, you can't change these things, right? But what you can do here is keep yourself fit, which means 40 minutes of exercise every day, covering 4 kilometers. Right? That is for a healthy heart. Whether you do a brisk walking, whether you step on the treadmill, whether you do a cross trainer or you do a bicycling, whatever you do, 40 minutes, 4 kilometers, it's good to let you go. Keep your weight under control. If you have diabetes or hypertension, keep them under control. And no smoking. It's not low smoking, it's no smoking. Because no smoking is as important as the genes. You have to, and these are modifiable factors, modifiable factors that you can stop yourself from smoking and be away from the body. Now, second aspect is of the same question which I am coming to is when you say fitness, you think of gym.
Yes.
And gym means you want to make your body perfect as anybody having 6 or 8 abs, and that is becoming again a fad nowadays. Go to gym, exercise, but do not venture out into taking anything additional.
The proteins and pills that a lot of
Sniffs, pills. These things have led on to a lot of heartbeat problems, sometimes sudden cardiac arrest. We find us more hearing or dealing with patients who are young, who start going to the gym. There they are given certain ingredients which they take, and they come back with either palpitations, chest pain. It is not good at all.
So I think moderation is the key out here, right?
No to these products is there,
Yeah.
but exercise, yes, that should be done.
Follow us to learn more about cardiac health, how to improve it, and how to stay fit, and understanding symptoms of a cardiac arrest or a heart attack. Stay tuned, follow us, and subscribe to this channel.